Okay, welcome to simulation. This is to remind you of the room. You've got your wash station, your soap, sink, paper towels. You've got your gloves here. You have your med station. In your med station, the only drawer you need to access is drawer 1. This will be where all your medications are. Anything below that you do not need to access. On top of your med cart, you have all your resources, your drug books, your calculator. You also have alcohol. You have a blood sugar machine with a crushing med apparatus with a pill splitter, and then your cups as well. To use the phone, remember to hit new call. This puts it on speakerphone, and you dial your number 744-6549. You do not need to pick up your headset. Just hit new call, dial number, and then that'll put it on speakerphone. When you're ready to hang up, just hit the red button here for hang up. This is to call your doctor, your nurse, your family, whomever that needs to be called. Continuing outside the room, you have your supply carts. You have 2 of them here. They're nicely labeled for easy access and retrieval of any items that you need. As you enter into your patient's room, so if this is your patient's room, you're going to enter in, of course, knock. You have a clock on the wall that should be set to the current time that you will be using. You have your monitor system. Just to remind you of your monitor system, you have your heart rate, which is 79. You've got your SAT 98, pulse 79, and you've got your respirations, which are 12, and your temperature. To get a blood pressure recycled, simple, easy, just hit start, stop here, and you'll hear that noise, and then that should be getting you a blood pressure check. Okay? If you have IV fluids going as you progress through the program, you might have to do IV fluids. You're just going to monitor the fluids, make sure it's the right amount. So you've got 0.9% sodium chloride. You're going to trail it down. Here, instead of the pump being on, we'll just put a little sticky note that says normal saline at 125. Continue to trail to your patient and then assess your patient where it enters. It is connected. There's no redness or swelling at the IV site. If you have to use oxygen for anything, okay, it's a simple, easy, you dial it up to the area that you need. So here on the side will give you points here. Here's another one, oxygen. So that's right at 1 liter. You can scroll it up. That's 2 liters and then 3. So the ball should kind of divide it in half. If you need a suction gauge, if you have to use suction for anything, such as the Yonker suction you have here, simple, easy, you either do regular, and that turns it on here, or you have full, okay? So that's how we turn on our suction. So your patient is easily accessible here. He does have pulses. Remember, your pulse locations are a little bit higher on the mannequin than on a normal patient. We would feel it here, but here is about the location for your mannequin, okay? So pulses are located on all aspects of your patient. And if you look back up here, we have a recycled vital sign. All right, so this is just orientation outside the room, inside the room.